Let's talk about sarcoidosis. It can be remembered with the help of mnemonic sarcoid. S stands for symmetrical bilateral hilar lymphadenopathy. So, due to the compression of these airways, the patient will present with cough and dyspnea. S also stands for steroid. The steroids are the mainstay of treatment. Systemic steroids like methylprednisolone is used. Let's come to A. A stands for ACE enzymes. ACE enzymes are elevated. R stands for remission. It's a self-limiting disease. In 50% there is remission. C stands for hypercalcemia because the PCT releases an enzyme 1 alpha hydroxylase which converts 25 hydroxy to 125 dihydroxycalciferol. So the non-caseating granuloma in the sarcoidosis, which is formed, which you will study in the pathogenesis, produces this enzyme, which causes hypercalcemia. So let's study the pathophysiology a little bit. The antigen MCAT from Mycobacterium tuberculosis is presented by the antigen presenting cells to the lymph nodes. In the lymph nodes, CD4 cells are present, which releases interferon gamma interleukins, which is responsible for the non-caseating granuloma. Coming to O. O stands for ocular manifestations. In ocular manifestation, there will be uveitis. I stands for interstitial lung disease. There is pulmonary fibrosis, pulmonary hypertension. D stands for derma. Dermatological involvements like pyoderma, no, sorry, erythema nodosum, lupus erythematosus. These are the dermatological manifestations. Most commonly, lungs are involved in this disease. Least commonly, heart is involved. Coming to the investigations, in investigation, you will go for an chest X-ray. Later on, you can go for a high resolution CT to prove your diagnosis. We can go for pulmonary function test, and there is increase in the CD4 to CD8 ratio. We also find lymphopenia, leukopenia in these patients. ALP levels are raised. Treatment, as mentioned earlier, systemic steroids are used, and topical steroids are used for the ocular manifestations. And in the refractory diseases, we use immunosuppressants like methotrexate and azathioprine. So this was all about sarcoidosis. Thank you for watching.